What exactly do you do within the field of diabetes?
Well, I'm the chief of the diabetes unit in the adult medicine service at Mass General Hospital. So I'm an MD, and I'm in charge of the diabetes clinical care unit.
Okay. How long have you been working within the field?
40 plus years.
Wow, that's awesome. What made you interested in doing this kind of work?
Well, I do two kinds of work. I mean, one kind is clinical care, in other words, taking care of patients, and a substantial part of my time is spent doing laboratory-based research. So, what got me interested in it was sort of the exposure to the illness in patients when I was a student and resident in medicine, and interest in some of the unanswered research questions in the field.
Okay. So in your own words, how would you describe this disease?
Well, Type 1 diabetes is an autoimmune disease where there's a very selective development of autoimmunity against the cells in the pancreas that manufacture and secrete insulin. And over a period of years, those cells are eliminated by the immune system, causing deficiency of insulin. And when that deficiency becomes severe, the blood glucose goes up and other metabolic derangements occur.
Okay. What organ systems are mostly affected by it?
Well, in the beginning, it's primarily a metabolic imbalance due to high glucose and inability to utilize and store nutrients. But over years, if the glucose remains high, damage accumulates in a number of other organs that is due in large part to the elevation in glucose in the blood. And those especially involve the large and small vessels in the body.
Okay.
So in the eye, there's damage to the vessels in the back of the eye. They become leaky and fragile. They tend to bleed, and that can interfere with vision. The vessels that supply nerves can be damaged as well. The kidneys can be damaged by the high blood glucose over a period of time. And the large vessels that carry blood to the heart, for example, can also become clogged with fat and inflamed, and that can lead to heart attacks and stroke.
Okay. Thank you. We just have a few more questions. How does someone get type 1 diabetes?
Well, it's a combination of genetic susceptibility and unknown environmental factors that modify that susceptibility. But even it's not entirely a genetic disease, because even identical twins who have the same genes, more than half the time, if one twin has type 1 diabetes, the second one never gets it. So there's a strong component of genes, but it's not a overwhelming determinant.
Yeah.
Have you seen someone have their life be like significantly affected by the disease?
Yes, many people.
And how so?
Well, because they've developed these complications of having glucose ineffectively controlled over many years. And that resulted in the kinds of complications that I described to you. Some people have lost their vision.
Yeah.
Other people have had heart attacks at a relatively young age. Some people have had loss of kidney function that have had to go on dialysis or have a kidney transplant. Those are serious events.
One last question. How do you see people treat it and live with the disease?
Well, it's the disease at present is controlled by administering insulin, usually several times a day, by injection or administered through a pump. That's the way it's controlled now. And so it places a great amount of burden on the patient because the determination of how much insulin to take and when to take it, how much to eat, when to eat, all those things have to be considered, and nobody's there but the patient. Certainly the doctor isn't there 99% of the time.
Mm-hmm.
So it's a lot of work.
Yeah. I could see how it's a lot of work.
And even sorry?
No, I could just say I could see how that would be a lot of work.
You know, and part of the problem is that the peak of occurrence of type 1 diabetes is early adolescence.
Mm-hmm.
So there's a big peak around age 12.
Yeah. Yeah, 'cause we just interviewed a boy from our college who has it, and he said he got it when he was 10, and it didn't start affecting him until like several years later.
Yeah, I mean, when you first become aware of it, when it first rises to what we call clinical significance, it's usually fairly straightforward to control. But with time, but at that point, there's usually some of your own insulin left, and that makes it easier to keep things under control.
Mm-hmm.
Keep things, meaning the blood sugar, under control. But as time passes, that capacity of your own pancreas wanes. It disappears, and that makes it puts more and more of the requirement for getting things straight in the hands of the patient. It makes it much more difficult to know how to do it.
Mm-hmm.
Your body isn't helping at all, in other words.
All right. So this is Paul.
Hello.
We're gonna ask him some general questions about diabetes 1. Paul, how were you diagnosed and when were you diagnosed?
So I was diagnosed March 19th, 2006. The night before, I was at a family function, just everything was normal. And then I come home, and I just started putting back glasses of water. My mom noticed that because she's a nurse, like she kind of clues what was going on. And the next day, I got really sick, and my mom told me that we were going to the hospital to see what's wrong with you. The doctors originally thought it was just some sort of infection, but my mom actually told them to test me for diabetes, and the results came back like, Paul, your pancreas is shut down, you have type 1 diabetes. And me being 10 years old, it was, I had no idea what was going on.
Yeah.
So I stayed in Children for a few days, got blood work done, and then I eventually came back to school and go about my everyday life differently than everyone else.
Mm-hmm.
So.
How, like Like from when you're 10 until now, how has it affected your everyday life?
Like, it was weird because I had no idea like what diabetes was prior to when I was diagnosed.
Yeah.
So like, from going to like being a normal kid to having to check my blood sugar close to 6 times a day, it was different.
Yeah.
Everyone around me thought it was different.
Yeah.
So, but as I got older, it grew on me.
Mm-hmm.
So now it's now it's just normal for me.
Yeah.
It's not normal for everyone else. I try not to let it hinder anything that I want to do in
Yeah.
life.
Yeah.
Yeah.
That's good.
So like, how do you check your blood sugar?
So this is called my PDM, which is a personal diabetes monitor, and it's a special blood test strip. Put it in, and then I prick my finger with a needle, and then it tests it, and it comes up with a number. So
And you do that like 6 times a day?
close to it, yeah.
Like every time you eat.
Every time before I eat, every time before I work out. So
Does it interfere with everyday activities like sports and?
well, I wouldn't call it interfering because I've gotten used to it.
Yeah.
So, but like before when I used to play sports, I would play like town soccer and town football, and it was just different because I had to go to the sideline, check my blood sugar, and then go back out while everyone was practicing already. So, but like I said, as I got older, it's just become a lot easier for me to just go to the sideline and do what I have to do.
When you were little, did you find it like hard to adjust to it? Like, did it take you a while to like?
So when I was younger and like freshly out of hospital, there was the stage that the doctors called the honeymoon stage, where my diabetes wouldn't affect me severely because every time I would check, it would be like a perfect number. But a few years later, it started to get worse, and I couldn't adjust properly, and I had to go to the hospital again to try and fix things. But after that, after like a proper regimen of diet and exercise, like, everything's just been the same.
Does it restrict you from certain things?
No, I mean I still play sports. I still go to the gym. I still do what I want to do. So it's just I try to not like keep it in the background, but it doesn't bother me.
Does it run in your family at all?
Nope, I was the first one.
Really? There's like no like thing about it.
In history
Yeah.
of our family, just happened.
It's weird.
It just happened. That's how it is.
So are you gonna you're gonna have it for the rest of your life?
But I'm on an insulin pump where it's easier for me to check my blood sugar and give myself an insulin shot. But I've been following up with some doctors from Type1 Diabetes Center in Boston, and they're working on an artificial pancreas where it's sort of like an insulin pump, but it's like an external pancreas. Like it would have the ability to sense my blood sugar and what I eat and do it itself. I wouldn't have to use that anymore.
That'd be awesome.
Yeah, that would be.
Just so many years down the road, though.